Good afternoon, everyone, and thanks for joining us during your lunch period. I'm really looking forward to this presentation from Jon Abbott of Cardinus. Other software providers are available, of course, but just a short intro. This will be recorded. If you have any questions, please can you put them in the Q&A chat. I hope you enjoy it. We have got more events coming up throughout the year. So please, I'd like to hand over to Jon Abbott of Cardinus to present to us. Thank you.
Tracy, thank you so much for the introduction, and thank you for inviting me to speak here today. And to everyone who's dialed in, I know your time is valuable, so I hope that on reflection you find these next 30 to 40 minutes valuable to you. Just by way of introduction, I'm Jon Abbott. I'm representing Cardinus Risk Management today. Within my role at Cardinus, I have two core areas of responsibility. So first of all, I am responsible for our office ergonomics proposition. And with that, I ensure that our products and services comply with national ergonomics regulations wherever they might be in the world, or to help reduce discomfort or injuries in those countries that do not have a regulatory standard, where we need to be having a positive impact on workers' compensation and healthcare programs. With my second role, I help global organizations, or those that have complex organizational structures, to first of all come up with a vision for their ergo program, to then specify, create, launch, and ultimately to manage it. And during this session, while I'm going to be talking very much about some global solutions and some global data, this absolutely does apply on a local level, or even for small and medium-sized enterprises. Now, Cardinus Risk Management is an end-to-end office ergonomics consultancy. And by way of disclosure, and to Tracy's note earlier, we do have our own online ergonomics management system called Healthy Working. I say that purely from a disclosure perspective, because a lot of the data and some of the principles that we're going to be exploring over the next 40 minutes do come from that tool. But as you all know, there are other systems available on the market, and you may even have your own in-house developed solutions too. And that's very much what my session is going to be talking about today. We're going to be looking at how data that we've been collecting over the last few years since COVID is showing us how our workers are reporting different pain symptoms to that they were presenting before COVID, and the severity and the extent that those symptoms are having on our organizations. So I'm hoping by the end of this session, what you'll get is a greater understanding of how we need to be either evolving our ergonomics program in response to this data that we're now collecting, or for those of you who are looking to implement a program, some great ideas and tips that you can take away to help you with that creation. So that's me in my professional life. Outside of work, I look completely different. This is me outside of work. I'm spent much of my time either hairy, smelly, or dirty. But let me tell you, when I'm talking about injury management, working with these beasts, I think I'm pretty well qualified, because I spend most of my time with some form of injury. So let's pick up and just come back to the Healthy Working and where this data's come from. So in 2023, last year, through Healthy Working, we completed over 5 million office ergonomic self-assessments. When you add to that the tens of thousands of virtual and on-site assessments that we also completed, it puts us in a very privileged position, because in doing so, we have access to a lot of data. And where our customers allow us to, we can utilize that aggregated data to uncover trends, identify when what the next issue is that we need to be addressing within our ergonomics programs based upon that data that we have. And so just moving forward to kick on, I'm going to start off with a quick question. I spend an awful lot of my time implementing ergonomics solutions for typically UK and US headquartered organizations. Now, there's very different motivators for organisations in either territory. So, for example, here in the UK, we have a regulatory standard. We have the display screen equipment regulations that I'm sure many of you will be familiar with. In the US, there is no federal standard. Some states are starting to implement their own local rules and requirements, but there is nothing federally that impacts on employers. So on the basis that here in the UK, we regulate for office ergonomics management, in the US, we do not. I'm going to ask you this question. Which country do you think has the best strategy for keeping workers free from office ergonomics injury? And as you can see, a poll has just come up on the screen. And if you wouldn't mind just letting me know what you think, that will be really helpful. The difference is pretty stark. We see this all the time. Lots of UK organisations, struggle to understand the US thought process without having a regulation, and vice versa. Often our US organisations don't understand the motivation or the reason for having a regulation in other countries around the world. So let's see how those results have come back in. Okay, well, that's pretty interesting. Interesting because, I don't think either country has got the right approach to it. In the US, what I tend to see is that organizations will run what I call a reactive program. So we will wait for a worker to put their hand up and ask for assistance. And my goodness, when they do, we swoop in. We want to make sure that we are giving that individual all the support, the guidance, everything that they need so we can prevent that discomfort or prevent that injury becoming a reportable under the workers' compensation or healthcare programs. Because let's face it, when it reaches that point, that's costing money. Now, in the UK and other regulated countries, and I increasingly get concerned about this, I worry that sometimes our regulations are so prescriptive that it narrows the scope of what we're trying to achieve. And I often see organisations who follow these regulations to the absolute letter of the law. And this, to my mind, is very much their detriment, because by following these regulations to the absolute letter, we sometimes fail to appreciate the wider impact of how our workplaces, but more importantly, our working environments are changing and how they're going to continue to evolve over the next few years. And let's face it, look, the workplace has changed a lot. We know that if you're a trader in a bank, your ergonomic requirements are going to be very different to a nursing station in a hospital, which will be different again to a control room within a manufacturing environment. But I'm seeing that, our workforce, and I'm sure you are too, is becoming increasingly more agile and mobile. We know we've got hybrid and home workers who are not working in optimal positions. We've got people who are working at kitchen counters. They are working at dining tables and chairs, and heaven forbid, we know deep down that we've got people working at couches. And I think we as organizations, we do need to start actively and proactively recognizing this, because we do have a wider duty of care. And if we know that somebody is working from a couch, we're bound to have to teach them how to work well at that couch so that they can keep their health and their wellness in optimum form. And if you look at some of the images on the screen here now, the proliferation of co-working spaces, I travel a lot. I'm sure some of you do too. And when I travel, I am often in a WeWorks or a Regis location. And I have to tell you, they're horrible. They're horrible to work in. The furniture is terrible. And within just a few hours, honestly, I'm usually experiencing some kind of discomfort. And if I'm in one of these environments for longer periods of time, I'm going to be in absolute pain. But the reality is, these spaces are here to stay. I've got a number of customers now who are formally contracting with co-working spaces so that they can give their remote workers somewhere they can go and get that engagement with other people, that whole social element. But more so beyond this, we've got people who are working in hotels. If you look at the agricultural sector, we've got people who are using tough books in vehicles. We've got an awful lot going on. And as I say, I think organizations will sometimes follow the precise letter of a regulation without actually addressing the very specific risks and real risks that our colleagues are experiencing. So I'm kind of skeptical between the two. The US absolutely will swoop in and deal with discomfort because there's a financial need to do that. They do not get into that preventative space. Whereas here in the UK, I think sometimes we can be a little blinkered, and in other regulated countries around the world, where we don't see that wider risk that we need to be addressing. So moving on, what do I see happens in the marketplace? Well, look, I think organizations typically have 3 types of ergonomics programs that they'll deliver. And you may see yours or something that is very similar to yours on the screen here. The first one, well, this is a very straightforward process. If a worker needs assistance, we're going to get them in front of an ergonomist, a physiotherapist, a DSE assessor. We're going to give them that hands-on kind of approach. We're going to address the risk. We're going to identify the recommendations. The individual is going to get a report with those recommendations, and hopefully we're going to put them into a good position of health. I guess this approach is a little like Ireland, where the assessment needs to be completed by somebody independent to the user. Challenge with this is it's a hugely expensive approach. You're putting each worker in front of a qualified expert. We do have a lot of customers that do that. They've got deep pockets. Their focus wholly and simply is on giving the individual the very best and personalized experience. But let's face it, we don't all work for organizations with deep pockets like that. So this second option is implemented very, very regularly, where we put in some form of online self-assessment or perhaps a paper-based method for assessing risks, so that we can start to build in some form of self-help control, some measures that the individual can undertake to mitigate the risk insofar as they can. Now, in just a few minutes, I'm going to take you through that self-help process and just show you in terms of data just how willing an individual is to self-help, providing the guidance is appropriate. But for those individuals where that self-help doesn't work or doesn't solve those issues for them, well, of course, we still then need to put them through that virtual or on-site assessment process with the follow-on reports and recommendations. So the idea with number 2 is it reduces the cost exposures in terms of the number of individuals that need to go through to that virtual or on-site assessment. Now, this third option, in my world, is probably the most common that I see in the UK, and actually I find to be the most effective in terms of managing worker health and keeping your costs under control. It incorporates some form of education. The DSE regulations require it. I'm a big believer in that. If we got an educated worker, we have an empowered worker. An empowered worker is able to take preventative steps in the future because they start to understand the risks that they're being exposed to and the steps that they can take to mitigate that risk. But what I'm going to come on to over the next few slides is to really look at how a one-size-fits-all approach doesn't work and can't work. I've already alluded to the different types of working environments, the different type of workstations that we're exposed to nowadays. But we've also got to look at each other as people as well, and how we all respond to data. You know, on a very general level, you know, I'm Generation X, so Gen X and Boomers, we're going to respond to data in a different way than Millennials and Generation Alpha. The way that we respond to communication, the way we respond to education is likely to be very different because we respond in different ways because we have different motivators. So in order to achieve really good outcomes from our ergonomics program, we need to understand the worker as well as the environment that they're in. But I'm also a big believer in being pragmatic. I'm sure that many of you working for any size of organization will have colleagues with physical, neurodivergent, and other types of challenges where an online approach perhaps isn't the most appropriate. An example I always give is, you know, if you've got an individual who is using a wheelchair and they never sit in an office chair, there's very little point in our ergonomics education addressing how to adjust a chair with a 5-caster base. At best, it's going to be patronizing. At worst, it's going to be insulting. So it's always worth making sure that where we do have nuance within our workforce, where we do have individuals that may need a more formal type of approach, that we have mechanisms within our process to get them the assistance they need in a really efficient kind of way. What I'm going to do is I'm just going to take a bit of a deeper dive into these different approaches. And I'm going to start off with that third option that I've just discussed. So this is an organization, it's a global organization, 24,000 workers across 67 countries. They work in the financial services sector. They have incorporated e-learning, self-assessment. They use a network of ergonomists to provide that backup support for those individuals that can't help themselves. And this is their experience. So at the end of the self-assessment process, we identified that 14% of their workers were in the high risk category. Now, high risk in these terms are defined by an individual who self-reports either daily or weekly pain, wherever that pain symptom might be, upper backache, lower backache, wrists, wherever. We're not defining it at this point. So through self-help, without any organizational involvement, the outcome was a reduction from that 14% down to just 5%. So what we've immediately done is to reduce our cost and resource exposures to just a fewer number of people that probably genuinely need that further expert-led support. So very, very positive outcomes. The self-help that was provided here was very clear. It was very well defined. We'll talk about this again in a few minutes' time. But to me, that reduction in high risk, while it is really impressive, is not the real story that we're looking at on the screen here. The big story for me is the no risk, those green segments. And just look, 22% of workers who had no issues pre this process increased to 77%. And I'd ask you this, could you imagine how wonderful it would be to be able to go to your leadership teams and say 77% of our workers are completely comfortable at their workstation. They're happy, engaged, motivated, all these other great things. That is such a positive message that we can take away, not just from our ergonomics program, but embedded into our wider EHS message, where, let's face it, we desperately need some of these really positive stories. But let's go and explore this high risk a little more, because this is where it kind of gets a little more interesting. So the three top issues for this organization are shown on the screen here. Their biggest problem was self-reporting daily pain in individuals' neck, shoulders, and upper back. Second issue, discomfort in the eyes. But then look, the third issue is daily pain in the lower back. Now, this is really interesting because before COVID, and many of you may be able to relate to this, wrist pain was always the most commonly presented area of discomfort. Having got through COVID, that has moved to back pain, both upper back and lower back, and we're seeing this replicated a lot. And again, we'll discuss this over the next few minutes. So 2002 incidences of upper back pain and lower back pain, either reported on a daily or weekly basis, were recorded with this particular organization. Now, some people recorded pain in both locations, 759. So what we're left with is 1,243 unique individuals who either self-reported pain in the neck and upper shoulders, the lower back, or in both of these locations. Okay, let's explore this a little bit further. Of that 1,243, only 40 individuals were exclusively based in an office. We'd kind of expect that. Most of our office environments have really good equipment. They have a lot of adjustability, and we have the engagement with colleagues, whether we're going to the water machine or we're just stopping and chatting to colleagues. There's lots of natural breaks and lots of changes in postures and working positions. A larger number, 253, work exclusively from home. But look, the largest population within this pain group are the hybrid working population, largest group by a country mile. But let's explore this a little bit further. So of the 253 individuals who work from home experiencing pain, 130 of them, a good number of them, are working from a couch, dining room table, kitchen counter, a non-traditional type of workstation. So a very high percentage of these home workers in that non-traditional working environment. Of those hybrid workers, we're seeing the same thing. Over a third of them, 345, are working from a couch, dining room table. 251 are reporting their home chair is uncomfortable. So what is this telling us? What it's telling us, we clearly have an issue. Now, whether or not your company policies might allow you to give people chairs and desks and whatever else or not is kind of immaterial. What we know is we've got a very large population of hybrid workers and home workers who are experiencing discomfort. So this tells me we need to change our communication methods. We need to change the education that we're delivering, and we possibly, if we're not delivering equipment, need to be looking for behavior modification options to help people take more breaks or change the area in their house they're working throughout the day. But what this is telling us, for this organization, we absolutely do need to get a review of our messaging to start addressing these very particular types of risks. Now, risk pain, I mentioned earlier, pre-COVID was our biggest issue. It does still show nowadays, but not to the same kind of prevalence. And interestingly here, the data isn't quite so clear. So again, the largest population experiencing risk pain within this organization are the hybrid workers. Of the 145 who work exclusively from home, 130 of them are working on that non-traditional workstation. So to me, that gives a very clear indication that there's got to be an association, because it's cracking on for 90% of individuals here are experiencing risk pain. For the hybrid workers, it's not so clear. We've not been able to determine the cause of this discomfort. We do have more work to do, but you can see how some of this data set is starting to give us greater clues, greater triggers that we need to respond to in terms of evolving our ergonomics program. Now, I'm going to give you a second example. It's a pharmaceutical company. Again, it's a big organization, 100,000 workers, 72 countries. Similar process. They follow that end-to-end, that third option, the one that I told you we see most frequently here in the UK. And the data sets are pretty much the same. 10% of individuals reported through as high risk in terms of that self-reporting discomfort. That 10% was reduced pretty much by half, down to 5%. But again, just look at that no risk, increasing from 21% to 81%. Clearly, we have a workforce who don't want to be uncomfortable. They're very receptive to messages to help them work well, to be healthy at their workstation. And the data like this is really showing that through, that the investment that these two organizations have made in their ergo program, in their wellness programs, are really having very positive results. 81% of people saying they are completely happy, comfortable, productive at their workstation. But here's where it gets really interesting. So the two organizations are very different, one in financial services, one in pharmaceutical, different types of environments. So we have laboratory environments, we've got manufacturing in the pharmaceutical space, we have people out on the road, sales reps loading samples in and out of the boot of their car. But the discomfort that they're experiencing is remarkably similar. The same top issue, people experiencing daily pain in their neck, shoulders, and upper back. Now, this is where it's slightly different. The organization before had eye pain coming in second. Here we've got weekly pain in the neck, shoulders, and upper back, followed by discomfort in the lower back. So this is all very much focused around the back position. Now, if we explore this again, there is another remarkable resemblance. So 1,524 unique individuals were identified through that process. A larger number of them are based in an office. That comes with a bit of a caveat, because for this organization, the office isn't necessarily a typical office. It could be a laboratory. It could be something that is, again, non-traditional for many of us. But the big population here is that hybrid working community. And if we look down further, 444, so again, well over a third are reporting that the home chair is uncomfortable. 257 report working from a non-traditional type of workstation. So what we have here are two very different organizations, very different workstation makeup, but remarkably similar risk profile in terms of people experiencing the discomfort through that back. The same type of worker, i.e. the hybrid workers, being those individuals who are experiencing it to the greatest degree, but also the causation being very similar, that it's that non-traditional type of workstation or finding their home chair uncomfortable. Now, I'm going to contrast this with an organization who uses that first option, that gold-plated process that I started off by going through, where an individual doesn't have any kind of education, there's no self-assessment. We're simply going to put them in front of a DSC assessor, ergonomist, physiotherapist, or other healthcare professional. Now, again, this is another large organization, 100,000 workers across many countries. The requirement here was very much that they wanted local support. So it was very important to this organization that whoever was doing the ergo evaluation understood the local language. They were bi or multilingual. They understood local regulation, but importantly, they understood cultural nuances. We provided them with two pathways in. So a worker could, they could just go in and schedule an assessment at will. There was no approval process, anything like that. The other pathway was where occupational health, an EHS professional, or anybody else who was authorized could schedule an appointment on somebody else's behalf. Now, of course, not using a self-assessment process, we don't have that data in advance, but what this organization put together was an intake tool process. Now, an intake tool process is a very short questionnaire just to ask some background qualifying information. Why would you like this assessment? Was it recommended by a healthcare professional? Are you experiencing some form of discomfort? And that's very much so that the consultant, before starting the assessment, had a little background information so they could be a little more efficient, a little more effective during that evaluation process. Now, the question sets are different from a self-assessment to this process. So there is a little bit of nuance in the data sets that I'm presenting here. But you can see the vast majority of individuals were requesting an assessment because they were experiencing discomfort, 62% of workers. But look here, 15% needed help with a furniture issue. 23% wanted support with setting up their workstation. Now, I would always argue, if somebody just needs help with a furniture issue, is there a better way of signposting them? Do we need to take 30 minutes of their time with a full-on ergonomic assessment? Or can we point them to facilities or whatever the support resource might be, so they can mitigate that risk themselves in a speedy process? I would always advocate yes for that. It also provides a reduction in cost exposures because there's fewer people that need to be seen by that DSC assessor or healthcare professional. What is interesting is the people who were reporting the discomfort, the 62% here, the biggest issue was mouse use with this population, followed by seating by quite a reasonable difference here of 13%. But when we go and explore it a little further, we find that actually the correlation comes back together again. So for those workers who were using a non-traditional workstation setup, 103 individuals in total, 40% of them were experiencing discomfort. So the question's being asked in a slightly different way, which might have an impact on the results, but the data set is looking to be very similar. Those individuals using a non-traditional workstation are experiencing the discomfort. For those individuals that were not using a company supplied chair, again, same principle, 46% of those were reporting discomfort. So again, very high percentage in terms of people who maybe making do and mend on that kitchen counter or whatever equipment they might be utilizing. What is really interesting though, and this is something I talk about a lot, we've looked at how education, how self-assessment, how that self-help engagement can really drive down high risk and increase those individuals who are experiencing no risk. Where you don't have that engagement, we see results like this. So 27% of individuals that scheduled their assessments or had their assessments scheduled for them, 27% when we ran these numbers did not show up. That's 1,202 assessments that were missed. Now, this organization has to pay for missed assessments. So this is expensive when you're not getting any results off the back of it. Now, we talk about this all the time, you know, just how much financial wastage there is. This organization really are not bothered by that. They want their workers to have this experience regardless of what the cost exposure might be. But the other element here, at the point we ran this data of 2,100 assessments that were completed, 1,631 workers stated they were not experiencing discomfort. So again, I'll just come back to this element of saying, do they need it? Did they need that expensive approach? Could that engagement, could the self-help, could the signposting have dealt with this in a much more efficient way, time-wise, and a much less costly way in terms of people moving through that ongoing process? And I'm going to put a little bit more weight on that because, you know, often when we look to implement, you know, software solutions, or when we look to implement a proactive DSC program, even if you're doing it in a classroom style method, excuse me, leadership teams can sometimes get a little bit jumpy about it. You know, if we start engaging with workers and trying to uncover risk, this is going to have a huge impact on our CapEx expenditure. We're suddenly going to have to start spending a lot of money to remedy this risk. And my experience is not like that. You know, some organizations, you know, again, those ones with deep pocket might throw equipment at a problem, but it isn't necessarily always needed. So again, with a project of 3,300 assessments for this organization, these are virtual assessments, expert-led ones, only 362 individuals needed some form of equipment-based provision. 277 of them were home workers, which you kind of expect. But just look, the vast majority of this equipment was low coster. Keyboards, you know, mice, laptop visors, you know, really low value stuff that is resolving a problem. Of course, there are instances where we do need that larger expense. You know, 114 desks, 101 chairs were specified amongst this group. But when you look at the chairs, 40 of those for advanced task chairs, which implies a need for them, 14 with tall cylinders. So clearly there's an anthropometric reason for those individuals needing them. So again, programs like this, where we're actively pushing out either in classroom style or electronically, do not need to be expensive. We can maintain a make, do, and mend mentality, or encourage people to change their working behaviors through behavior modification. And just sticking on this cost element, I'm just going to finish the financial bit on just this last slide here. Back in 2021, we started working with a mining company out of Brazil. Now, these guys wanted a similar approach. They wanted to offer all of their workers a live virtual assessment. Now, in their first tranche, if we look at the original risk here, there's probably, I don't know, about 5,300 individuals. So had these 5,300 individuals all had a live virtual assessment at fees of $156 per assessment, well, they're outgoing sort of in $916,000 US. That's a lot of money for any size of organization. So then maybe if we looked at that second option where we build in the self-assessment process, well, that would have limited the numbers down to what, about 4,500 individuals. So had we done that at the rate of 156, their cost exposure would have been slightly lower at 710,000. But my gosh, that's still a huge number for any of us when we're trying to manage our budgets. By utilizing the end-to-end process, which they did, by engaging through e-learning or other forms of training, through using self-assessment, again, online or through a paper-based method, if we were to just offer those medium and high-risk individuals then a virtual assessment where the self-help hasn't worked, well, then we're reducing the numbers that qualify down to just about 500. So again, $156, you're looking at a cost exposure of $77,000 US. So really this process can make a fundamental difference in many, many ways, because had they gone out with that first option, $916,000, compared to where they actually ended up at $77,000, that has an incredible impact on any type of organization and any type of EHS budget. So whether you are looking to implement an ergonomics program, or whether you're looking to drive better outcomes from the program that you might have now, whether that's in-house or a commercially available program, what would I suggest? Look, I'd always suggest that technology, while I'm a big advocate because it does give us really great data that we can use to evolve our program, evolve our learning message, it really can't be the be-all and end-all. We really need to make sure that we are giving individuals, if they have a neurodivergent physical difficulty, we are giving them the ability to get to resources as quickly as possible. I'd look to what other kind of resources you have within your organization. How can we remove barriers to access? Many of you, I'm sure, will have some form of learning management system that your colleagues will be very familiar with accessing education. And if you do, then let's integrate the solution, a commercial or in-house package, through that. So we're not changing processes for our colleagues. When we're talking about self-help, if you have ServiceNow, or you've got facilities processes, and you're allowing people to make discretionary purchases, again, let's look at the integration into those systems so that your colleagues, if they do need to get a new mouse, do need to get a new keyboard, and are able to do that themselves, can do it quickly, seamlessly, and in a way that they don't find to be burdensome. I would absolutely suggest that you step away from a one-size-fits-all approach. I alluded at the beginning of this talk that our workstations are different, and they genuinely are. And the more you start to explore how people really work, the more you'll be surprised at just the variety of activities that you have going out there. There's 3 examples here. Amgen, they with their Ergo program identified a high propensity of lower back pain, which when it was explored, turned out to be amongst their pharmaceutical reps that were in the car all day, loading samples in and out the boot of the car. Now that we know that, let's address that again through education and through managing that risk. A global bank that we work with, they have lots of people traveling around the world. Their issue is with handling, with people loading cases into the overhead lockers of planes, and then working in hotel rooms. And let's face it, for any of us who have tried to use a laptop in a hotel room, we know that it's not easy. We have a customer who has lots of operatives working on ships where their chairs are bolted to the ground. There is no adjustment whatsoever. So again, in those kind of circumstances, to deliver a one-size-fits-all educational approach and or self-assessment approach really doesn't achieve the outcomes that you're looking for, because the worker is not empowered, they're not engaged, and the risk profile that you get back for them is not truly representative of the actual environment they're working in. But just to wrap up, a couple of other key points. Know your policies. What we've looked at here are 3 organizations who clearly have an issue with a hybrid working population, who clearly have an issue within that population of people who are finding their working area uncomfortable, their chair is uncomfortable, their working environment is not supporting them properly. Do you have to give them equipment? You don't have to in law. There is no requirement for you to be giving people desks, chairs, and let's face it, they may not want it anyway for a variety of reasons. Everything needs to be risk-based. But even if you don't give people equipment, know your policies, be open, be upfront about them so that you're not setting an unrealistic expectation with your colleagues. And then make sure that if you have these set positions, that you're making sure that content is applicable to those workers, that for your home workers, your hybrid workers, they're able to work within those parameters. So remove those barriers in terms of, people need access to facilities, if they need access to your supplier portals, try and integrate those elements. 2 final points I'd say is consider languages. If any of you have got a footprint outside of the UK, languages can matter. And it's very easy to say that if you've got people based around the world, we need to deliver in those local languages. Just as easy as it is to say, we have English as a company language, we're going to be delivering it universally through English. Again, nuance matters. If you've got somebody where English isn't their first language, they may cause some difficulties trying to file a claim, just saying they didn't quite understand it. So it's always worth speaking to your learning and development teams or your HR teams just to find out what are your policies in terms of delivering languages. But also culture. Culture is hugely important too. During COVID, many ergonomics consultants delivered a lot of virtual assessments. And this is a little bit of a generalization, but often when we were delivering a virtual assessment in Japan for home workers in Japan, we found they had a propensity to sit low to the ground, if not on the ground. The home was a very quiet, very respectful kind of place. And our consultants had to respond to that in order to get the best outcomes from the session. Conversely, colleagues in India working from home, the house tends to be a much more vibrant, much more engaging kind of environment, more people. So again, to get the message across, consultants have to change their attitude, their approach. So cultural differences absolutely matter if we're trying to get people to change their behaviors. Now, if anybody's interested, we do have some free resources that might help you out. First of all, we created a guide to help you to either create in-house an ergonomic solution or a guide to buying something off the shelf. And this is a really great guide. Whilst we've written it, it doesn't mention us at all. It takes you through a glossary of terms that might impact you in terms of information security considerations, learning management system integrations, that kind of thing. So it will give you a lot of information to help you to decide how to structure an ergonomics program and what vision you think that might take. Secondly, if anybody is interested and does have a footprint outside of the UK, we have created a guide that tells you whether you have an educational obligation or a self-assessment obligation in 191 countries around the world. We support that by taking the paragraphs from those regulations from the Act or the labour law in support of it. So it'll give you all the information you need to know to understand what you need to do in some of your offshore facilities. And finally, again, free of charge, we've taken a really deep dive review into hybrid working regulations in, I think now, 103 countries. And that will give you the ability to undertake a gap analysis between your current provision and what the regulations might require in those countries. And if you'd like a copy of that, just simply drop me a line or reach out through IOSH, and we'll make sure that you get those materials straight away. But that's me done. So thank you so much, Tracy, for giving me the opportunity.
Yeah, thanks, John. That was really useful. We've got quite a few questions, actually, if you don't mind if I run through them.
Of course.
Yasin wants to know the statistics that you mentioned, are they in the UK or USA?
So one is UK, but the first data set I showed was UK. The second data set is global, so it's a very wide footprint. But we do see that the type of discomfort is truly replicated worldwide.
Okay, thank you. Christian's asked about the varied desk options that people have that they attach to their desk. And do you know anything about whether companies actually monitor the use of those and how often people have them raised or lowered? Or any views on them? I know I've bought a couple before.
Right. I'm probably not the best person to ask about this because I'm not a furniture guy, but I do have a lot of anecdotal evidence. A lot of organizations will buy both the Veridesk and the sit-to-stand workstation. I'm one of them myself. If my desk is low when I come in the morning, it's going to be low when I leave at the end of the day. There are some tools out there. I believe Wellnomics have a piece of kit, and Bakker Alkhuizen out of the Netherlands that do give you the ability to formally monitor whether people are using those sit-to-stand desks. And it's worth exploring it, because if people aren't using them, they're a waste of money.
Okay, right. Christian, one of our committee members, is asking about 25% of our members in our group are managing health and safety outside of the countries you've mentioned. And what are the key differences in approach or ergonomic management takeaways for those markets?
Okay, so it very much differs on what the motivator is. So if there's a regulation in a country, then you're going to get the guidance. That's really clear. That's very helpful. In a non-regulated country, you really need to be looking to what is the motivator out there. It's typically workers' compensation insurance or healthcare fees that drive an ergo program. You tend to find, as I mentioned earlier, that in a non-regulated country, people run a reactive program. So they deal with an issue as it arises, rather than working in a preventative way, which is nonsensical to me, but it's an approach that those organizations take. In regulated countries, it is worth understanding the nuances that's associated with it. So, for example, in Bulgaria, when it comes to DSE management, if you are under 40 years of age, you are assessed every 3 years. If you are 40 years or over, you should be assessed on an annual basis. So there's some little nuances in there that you do need to know about, that it might be left field. Where else can you discriminate for somebody based upon age with something like that? So it's worth understanding what your local requirements are.
Somebody else is asking about height adjustable desks, saying that they're being asked more and more for these and would only generally provide them if recommended for medical purposes, but it's unclear as to when an employee might benefit from having one. Should she be rethinking this?
Again, I'm not a furniture person, but the sit-to-stand manufacturers, they've coined that phrase. Sitting is the new smoking. We've been sitting for forever. The biggest thing from my perspective is about movement. Often people in their home don't even want a regular desk, never mind a sit-to-stand desk or anything like that, because of the visuals of it or whatever else it might be. If you've got a doctor's note, I think you really don't have any choice. You have to respond to that. Most organizations that I work with will only provide a sit-to-stand workstation if you've got that doctor's requirement. You do find that it can cause other problems. People stand for too long and they don't move around well enough, or they don't wear the right footwear, which can cause knee problems. So it's not just a case of providing somebody with a sit-to-stand workstation to solve an issue. There's an educational need around that as well, to make sure that people are using that sit-to-stand workstation properly, else you could be causing other problems trying to solve an initial problem.
I know at my organisation, lots of people expect, and as we do new offices, we do actually put all sit-stand desks in, and people tend to expect it now, even though there's not anything in the regulations that says you have to provide it, not in the UK anyway. So
luckily the price is coming down a lot now, so it is much more within people's grasp. And I would always say, if you can afford them, use them, but then you've also got to think about that whole 95th percentile. I'm 5'2". Even when it's at its lowest point, it's no good for me. And then with taller people as well, you still have issues that might not be addressed by those sit-to-stand workstations.
Yeah, okay. Somebody else is asking about how you do workstation assessment for an FPSO. And I had to ask what that was, to be honest. I didn't know what that was. And he said it's a floating production, storage and offloading in the oil industry. New one on me. It's a new one on me. But
you're well outside my pay grade here. Look, we do a lot of work in the oil and gas sector. We work with a number of global household names. I'm going to need to speak to some of my colleagues in how we address that. We almost certainly do. So if I may take that offline and come back to you, that would be tremendous. Because if not, I'm going to be jabbering away completely nonsensical.
Okay. I've just got a few more then. So are regulations changed in response to hybrid working?
Yes,
or
absolutely.
Do you think they're going to?
Yeah, absolutely. So Mexico, last year, they updated their regulations, not necessarily just in terms of ergonomics, but also to cover off other factors. For example, the risk of domestic abuse. We need to give people processes to go through if we're potentially causing people to be working from home for longer, where they might be in a more dangerous situation. Portugal, for example, they updated their regulations in July last year too. So we are definitely starting to see a move to government starting to respond to this. This is a plug. We do have the regulatory guides that I mentioned just a few minutes ago. We update them on a regular basis. So if anybody has a footprint outside of the UK and you'd like to understand what your obligations are as of now, we can certainly provide you with those guides. But yeah, keep an eye on it. Governments are looking and addressing this, not just because of the ergonomics risks, but because there are many other risks in terms of lone working, slips, trips, all those other kind of things too.
Right. Is there a legal, I think you covered this a little bit, but is there a legal requirement to provide people with a desk, chair and other equipment at home?
No, there's not. Some countries you do. Here in the UK, it's risk-based. Is an individual exposed to harm, however they're working? If they are exposed to harm, if they are experiencing discomfort, you have an obligation to address that. You may not necessarily have an obligation to provide them with equipment. It could be more of a behavioural type change. It's really working with that individual to understand what is the best solution for them. I lost my train of thought very briefly on that. I would also consider the fact that depending upon the makeup of your workforce, so for those of us who have populations in metropolitan cities, well, often the younger workers are going to have smaller apartments. They're not going to have the space for that kind of equipment. So it's worth thinking about these things through too. You might have the best of intentions, but they might simply say, no, it's going to affect the aesthetics of the home. Where you do have that though, COVID was just so transformative in terms of ideas. I think on Amazon, within just a few weeks of COVID, you could buy cardboard desks that you could pack up and pack away at the back of your wardrobe. There's some really brilliant ideas out there that might help, but no, you do not have an obligation to provide people with equipment unless they have an issue that they're reporting to you. You have then got to figure out what that solution is going to be to prevent that discomfort or that injury.
Yeah, I mean, I think a lot of companies have different policies. I know we have different policies if you're a home-based person on a home-based contract or a hybrid person.
Yeah.
And I know I was in Spain yesterday and they were talking about, I think it was if 30% of the work is done at home, they have to provide things for home. So again, as you said before, it's best to look on the local regulations, isn't it, or the country rules for that as well.
Yeah. One point I would make though is I do have one organisation who has taken the approach that look, you're not commuting to work, you're saving a ton of cash, so you're responsible for buying your own equipment. But people don't know what to buy. We saw this during COVID. People were given stipends, and they bought the most ridiculous things. Like it was crazy. So
you've got no control over that, have you?
Exactly.
If they do that.
So I think we just need to give people some parameters. This is if you're going to buy something yourself, this is what we recommend, and this is why we recommend it. People don't know what they don't know.
Yeah, true. Last question then, I think so far. What is the biggest challenge associated with implementing a software solution?
Your IT colleagues, absolutely your IT colleagues.
I could answer this, I suppose, through experience, couldn't I? But yeah, I think that is true. It is IT colleagues.
Yeah.
The amount of hoops you have to jump through and the cost and the time it takes.
Yeah,
for me personally on my organisation.
Absolutely, Tracy. Like, information security nowadays is we stand and fall by it. It can destroy our organisations. And here we are collecting data about people's risk exposures. We're not collecting personal sensitive data, we're not collecting height, weight, anything like that, but we are collecting data. And your information security teams are crazy busy. So if you are looking to implement some form of software, I'd engage your IT teams early doors. I would also, again, just talking about your footprint out of the UK, if you've got facilities in Germany, France, the Netherlands, engage with your workers' councils too. The earlier you can engage with workers' councils, the easier the process will be, because these groups tend not to like to be introduced to something in the last few hours of it. They can absolutely pull a slammer and stop your program, and they do. So yeah, IT guys, workers' councils, it's that engagement in the business to get the best outcomes. Yeah.
Great. Okay, thanks, John. That was a really great presentation. It was recorded, so it will be available via IOSH. Thanks to everybody who attended. Please can I make a plug for our next event, which is on the 19th of November, about Building Fire Safety Act, and it's with ARC Workplace Risk. It's being run by Christian, another member on the committee. Look out on LinkedIn, look out IOSH members, you'll get an IOSH mailing about it. But please join if you can. Thanks everyone for attending. Have a great week. See you soon.
Thank you, everybody. Bye-bye.